above 15, 16 or so, homocysteine molecule itself becomes a neurotoxin and will start killing neurons. So I'd say if there's one thing you get from this lecture today, it is, I think, and the other thing is that levodopa actually interferes with folic acid and B12. I firmly believe it is the ethical obligation of any physician prescribing levodopa to be monitoring for side effects related to levodopa, right? It's a cheap test, it's covered by insurance, and there is a ton of data linking high homocysteine to worse outcomes in Parkinson's disease. And some of those, I love levodopa, but this might be a medication side effect in some people. And so I think if you are on levodopa, it is really important once a year to have your doctor measure your homocysteine levels, and let's keep it below 10. So one of the reasons that the homocysteine levels go up is B12. B12 is sneaky. You cannot order a serum B12 and say a person does or does not have B12 deficiency. There are 3 different tests that you have to order. To be able to say somebody does not have B12 deficiency, you need to order a serum B12, homocysteine, and methylmalonic acid. And any one of those can be the manifestation of a B12 deficiency. But what we do know is that the lower your B12 level the day of diagnosis, the more likely you are to have a worse progressing disease. People with low B12 are more likely to have neuropathy, nerve pain, and folate levels, which also raise homocysteine, are associated with increased risk of depression. Here is a publication from 2014 that just says B12 deficiency can cause tremor, Parkinsonism, dystonia. Just saying, I'm not making this up. There's a lot of research that says B12 deficiency can be a really big problem for people with Parkinson's. Even for people without Parkinson's disease, 10 to 15% of people over the age of 60 have B12 deficiency. With age, our stomach lining starts to get a little less healthy and do less of a good job absorbing B12. Medications that you're on, if you're on medications for reflux, those diminish your body's ability to absorb B12. Autoimmune diseases put people at huge increased risk of B12 deficiency, and the symptoms of B12 deficiency, you'll note, are really common in the elderly. Neuropathy, pins and needles sensation, spinal cord problems, and cognitive impairment. It also is true that people with Parkinson's are unusually sensitive because as we give you dopamine, as you metabolize dopamine, that uses up more B12. So even though I'm using reference ranges suitable for the typical person, there's reason to believe people with Parkinson's may actually need more B12 than a person without Parkinson's. Methylmalonic acid is just another way to measure B12 deficiency. Of all the people I tested in here, that is a measure of B12 deficiency. I don't think there was a single person in here who had high methylmalonic acid. There are a lot of people who have low B12 and high homocysteine, so I'm not going to spend too much time on that. Here's a paper that was published last year in the journal Movement Disorders. High homocysteine levels at baseline predict greater cognitive decline over time. It's not the first time that's been published, but we keep reaffirming those data. And from this year, a study that said elevated homocysteine is significantly associated with some aspects of cognitive function in Parkinson's and may represent a treatable risk factor for cognitive decline in PD. This is not alternative. This is cutting-edge thinking in the field of neurology. So in clinic, how do I reduce it? As I said, cheap and simple. There are tons of products designed to lower homocysteine. This is what I have no financial relationship in any supplement product company, anything like this. I don't get kickbacks from any of this stuff. But this product has been probably one of the most effective, most useful, least expensive. 2 pills a day. I'm not going to spend a lot of time on the complete blood count. That's pretty standard. What I'm looking for there is you can get other hints at B12 and folate deficiency. Thyroid, again, is not something that is particularly problematic in Parkinson's. I mean, there have been some studies that say people with low thyroid can have a worse exacerbation of Parkinson's disease, and There is a little bit of research that says people with Parkinson's might have kind of more subclinical low thyroid function, but this is not one of the big ones. This is one that it makes such a difference for somebody who has constipation and fatigue. It is so easy to dismiss constipation and fatigue as due to Parkinson's. Well, of course you have fatigue and constipation, you have Parkinson's. And then you realize the person has hypothyroidism, you get them on a thyroid supplement, and you know what? It wasn't due to the Parkinson's, it was the thyroid. And so it may or may not be relevant to you, but I do think once a year, given how common low thyroid is in the typical aging population, I do think it's an important rule out. The reason I looked at iron is not because I'm worried about iron deficiency. One of you in this room has pretty notable iron deficiency. I'm not really sure what's going on. I put a little note, please come talk to me. But really, most of the time, what I'm looking for when I measure some people's iron measures is, are you high in iron? There are several studies that say men get more Parkinson's than women until menopause, and then it evens out. We think part of that might be menstruation is helping decrease your iron levels. You can kind of think blood is fairly rich in oxygen and iron. What happens when you have oxygen and iron? Rust. So guys are essentially rusting faster than we are, right? And so iron is very, very what we call prone to oxidation. It is very susceptible to free radicals tweaking it and causing some problems. And so what happens is, back in the day, we learned that iron deficiency anemia was a really big problem in some communities, in kids. If during your early years you have iron deficiency anemia, it really translates to impaired cognitive function, right? And so we don't want that in our children. So what we started doing is fortifying all of our grains and bread and rice and oatmeal and cereal with iron. And so now, while we have stopped a whole bunch of children from becoming anemic, having iron deficiency anemia, we've probably overshot the target a little bit, and it might be contributing to some of the oxidative damage stuff that we're seeing here. So I would say 20% of the people in this room actually had overtly elevated iron measures. Like, you know, on when we measured here today, your iron levels are high, your TIBC is low. So I marked that, and what I'm asking you to do, if you're one of those people, is start watching where your iron is coming from. Where are you getting it? You can get it from cast iron skillets. Certainly you can get it from red meat. But the number one place most people get it is in fortified cereals, grains, breads, things like that. There are a whole bunch of YouTube videos where kids hold magnets over their bowl of cereal, and there's so much iron that the cornflakes will follow the magnet around the cereal bowl because there's so much iron added to your grains. F2 isoprostase, this is the urine test that we did on you, and what we're looking for here is free radicals. This is actually a very accurate way to measure free radicals. We know that these levels are higher in people with Parkinson's disease. And to be blunt, what this is a measure of, are you fresh or are you rancid, right? And so the higher this number, the more oxidative damage you have, right? The more free radicals are attacking your body. And so free radicals what they do is they start to tweak the shape and structure of DNA, fats, proteins, and that's where you run into problems. There's even research in cardiovascular disease saying, yeah, you know, we've done a lot of research on cholesterol. Cholesterol is certainly a factor in heart disease. What really matters is the oxidation of cholesterol. When cholesterol gets oxidized, that's when it really starts to be problematic. So this whole idea that free radicals are attacking normal body parts and making what used to be safe now problematic is kind of where we're going with it. So the older you are, women have higher levels than men. The more alcohol you drink, cigarettes you smoke, and people with cardiovascular disease all have higher levels. And the reason this matters so much is there's a whole bunch of research that says when free radicals attack your lipids, what happens is proteins start to misfold, which we're all trying to stop. So they did a study with dietary antioxidants. They looked at 113 different studies, and in almost half of them, you could dietary antioxidants, brightly colored fresh fruits and vegetables, nuts and seeds, were associated with their ability to reduce these free radicals in the system. Another study looked at coenzyme Q10, showed that CoQ10 supplements were able to reduce F2 isoprostanes. So again, not everybody needs to rush out and start this stuff. For those of you who are elevated in F2 isoprostanes, it might be time to pay a little closer attention to some of this stuff. There's been a ton of research in vitamin D. This is a meta-analysis just showing that in general, across the board, people with Parkinson's tend to have lower levels of vitamin D, even when we compare you to patients with Alzheimer's disease. People with Parkinson's are lower. In Parkinson's disease, low vitamin D levels have been linked to constipation, inflammation, impaired balance, muscle weakness, depression, and risk of dementia. Okay? The vitamin D level I asked you to target is about 60 to 80. There are a whole bunch of studies that say, below 50 you're at increased risk of different cancers and things like that. So I want you higher than 50. There's actually quite a bit of wiggle room before we have to worry about toxicity levels. But what I find is as soon as you get around 100, your other docs start calling me and accusing me of making vitamin D toxic. So this tends to be a nice little window where I feel like you're in the safe zone, good for neurological health, but I don't worry about toxicity. And then it's not that black and white. I can't take two people who have the same vitamin D level and give them the same dosing recommendation. It depends on how far from the equator you live, how much skin exposure you get, even if you go for a daily walk. If your clothes are covering your skin, if you have a hat on, you're not getting the sunlight on. You need the sun on your skin. So it depends on the season, geography, how much of your body you cover. There are a whole bunch of reasons people who have obesity need higher vitamin D levels to raise their level. We have done a bunch of research here and linking the relationship between the higher low vitamin D levels are associated with more inflammation, and the other blood sugar ties into this whole thing. So the higher your blood sugar, the greater your level of inflammation and oxidative damage. So bringing us to blood sugar, this is just an oversimplified snapshot of some of what we see. There's something called atrophy. We are all have shrinking brains. From the age of maybe 18, 20 on, our brains all start shriveling up and wasting away. In theory, a healthy brain should lose about 0.25% per year, is what most is considered healthy, but you can see as blood sugar levels go up, the rate of brain loss increases, right? And so I find it interesting that in the United States, we actually start flagging you as having high blood sugar at 5.7. So it's when you're in this column that we say, hey, you might want to watch out. So I'm going to say, I'm raising the standards a little bit. I'd like to see people in one of these two columns. I don't think we need to wait for the 5.7 to flag you. I think lower is better. Brain is made of fat. Here's some neat, I won't get into that part. There's been a bunch of epidemiologic research just looking at fish consumption around the world. This is a neat study that shows the more fish any country eats, the lower the rates of depression in that country. And there's this really fascinating calculation that was done. What they did is they looked at Americans consuming fish, and they broke them up into quartiles. And the researchers kind of estimated the risk of dementia in the lowest quartile, the highest quartile. And the equation, the result that they walked away with is they said if we could get the bottom three quartiles of Americans eating as much fish as the top tier, we could reduce dementia in this country by 40 to 50%. Those are huge numbers. We are not taking advantage of some of the data we already have, right? DHA has a million roles in the brain, from structure to function. It shapes neuronal cell membranes. It changes the way one cell communicates with another. There's something called BDNF. It's like a growth factor for neurons. It's an antioxidant. Adults don't grow new neurons, but they can grow new little branches that make one neuron behave like 3 or 4. And the higher the DHA level, the more of those branches you grow. Arachidonic acid is on your form. It's an inflammatory lipid. It's the most inflammatory lipid in the body. I want levels less than 9. And again, if people are higher than a 9, the number one, the primary sources of arachidonic are from the diet, and it is from eating a lot of chicken, eggs, beef, and pork. So guess what I recommend? Uric acid is fascinating. We've known or had some hints for 30-some years now that people with gout don't get multiple sclerosis, and then we learned that people with gout seem to have some protection against Parkinson's disease. We started looking at some research showing that the lower uric acid levels are early in diagnosis, the faster people progress. And we do know that there are some supplements you can take, some things that you can do that can fairly easily change uric acid levels. There was a big study that just failed last year where they actually tried to give people inosine as a way of raising uric acid levels with the hope that we could slow Parkinson's progression. And for whatever reason, the way the study was set up, that's a whole separate topic, they said that the study failed. And their outcome measures were largely motor. And the other thing that kind of, my issue with that study is they didn't look at diet at all. So the data says the more fresh fruit you eat, the more fresh fruit you eat, the higher your uric acid. The more dairy you eat, the lower your uric acid, right? And so I wish that had been taken into account. We had done some additional analysis with that. But what I will tell people is don't spend your money on that supplement. You don't need to go start taking another pill. Just please reduce dairy intake and load up on fresh fruit. And it's specifically fruit sugars. For all of you who are afraid of sugar and fruit sugar, in this instance, the more fruit sugar, the better. It is fructose that actually raises uric acid. DHEA is kind of a spunk and vitality hormone. It decreases with age. We have never done a study with giving DHEA to people with Parkinson's disease, but we have given rodents with Parkinson's disease DHEA a few times. When we do that, their neurons live longer, they make more dopamine, they have fewer motor symptoms, and they live longer. So I don't recommend this for everybody, but I think for people who have a little bit more apathy, depression, or a little bit withdrawn, their feelings get hurt easy, they feel a little beat up easily, this is part of the profile that I do. And the other thing I want to say about this too is a safety issue. The things I've talked about so far are actually really quite safe. Vitamin D has potential toxicity we have to watch out for. You don't want to go too high. Too much fish oil, you'll probably get loose stools. I mean, most of the stuff we've talked about, the major side effect is your pocketbook. This is a big deal. This is a hormone, and it will turn to estrogen and testosterone. If you have ever had prostate cancer, breast cancer, uterine cancer, ovarian cancer, a tumor that grows in response to hormones, I don't want you taking DHEA. I don't care if you've been cancer-free for 5 years. It's not worth the gamble. I'm not comfortable with it. And so this also speaks to the idea that we need your providers paying attention to this, because it is not always safe to just start doing over-the-counter supplements here. Cholesterol is what we call a U-shaped curve. Everybody knows that cholesterol levels can be too high. I agree, they can be too high. Vascular Parkinsonism is a whole separate but very real thing. I don't want anyone here having cardiovascular disease. I do not want my recommendations to increase your risk of heart disease and stroke. I want to protect heart and brain. I feel like there's a lot of attention going to preventing your cholesterol levels from being too high. What I'm actually worried about is cholesterol being too low. Cholesterol is what we call a U-shaped curve. Most of the cholesterol in our body is in our brain, and if cholesterol deficiency has been associated with neurological and psychiatric issues, and from cholesterol, we make vitamin D, we make our ability to not get dizzy when we stand up, our stress hormones, our estrogen, our testosterone. And so what I often see is low cholesterol for one of two reasons. Either a person had high cholesterol, they were prescribed a statin drug, and we kind of overshot the target a little bit. Now they actually have cholesterol levels that are too low. or it's an intestinal malabsorption thing. What happens is that we make about 2/3 of our own cholesterol, and we get the other third from diet. And so when people who are not on a statin have low cholesterol, most of the time it's either because they're on a very, very low-fat vegan diet, or they have malabsorption issues in their gut, which is most commonly the case. So this is the summary page. When you go home, you can look at this, download this page. This is kind of the summary of what I put on the PD panel, what I use in my patients. Every year I ask my patients to do this as I checks and balances, just make sure I'm not missing something. And kind of in summary, I'll just say, we don't know if we don't look. I might get in trouble for posting this, but I removed all the names. But before this talk, I got this email. Dr. Mischley, one of our members sent the PD panel to her doc to ask if she should do the labs. See what he wrote below. Do you get this often? So the physician, whose name has been removed, said, I reviewed the blood test panel. They are completely useless and have nothing to do with Parkinson's disease. She can do it locally, individually, or as the panel, but they are not related to Parkinson's at all. So with that, let's take our break and say,
and get the test.
Let me just say, and again, I'm being funny here and trying to say, listen, there's evidence here. I try to present as much research as possible. But as an alternative medicine physician, you know, I get called, you know, alternative, right? It is almost comical to me that this is biochemistry, right? Like, I'm taking this from the medical textbooks, I'm taking it from the literature, and I'm sending your biological samples to a lab where it's analyzed, and I'm interpreting it accordingly. And then you have physicians who are intuiting that you don't have a nutritional deficiency issue to worry about, right? And when you really take a step back to say, well, what's the alternative one here? I actually feel like the person who is intuiting that you don't have a nutritional deficiency is notably more alternative than the person who is sampling and testing and using research. So,